So many of these health inequalities have existed for decades. Why do you think these problems still exist?
That is a really great question. Yes, the problems have existed for as long as we've had data. In 1899, W.E.B. Du Bois wrote a book entitled The Philadelphia Negro. He was an African American giant intellectual of the late 19th and early 20th century. And in his book, he talked about the gaps, and he showed the different wards in Philadelphia for blacks and whites, and the same kinds of data we see today. He showed the racial differences that existed. As he came near to the end of his chapter on Negro health, he called it, in his 1899 book, he said the most difficult social problem in the matter of Negro health is the peculiar attitude of the nation to the well-being of the race. And he continued, there have been few other cases in the history of civilized peoples where human suffering has been viewed with such peculiar indifference. So he's saying the fundamental problem of racial disparities in health is that the American population just does not care. He called it peculiar indifference. Scholars study it today, and they call it the empathy gap. And research shows, there have been studies in the United States and studies on every continent, that there is a racial gap in empathy, that adults feel the pain and suffering of someone of their own group more than someone of a different group. One study in the United States of white children looked at the empathy gap at age 5, age 7, age 10. What they would do, they would stick the person, an adult, show them a picture of someone being stuck with a video, of someone being stuck with a needle, and ask them how much pain you think the person is feeling. If the person was white or black, at age 5, there is no difference in the amount of pain that the children are reporting the patient is experiencing. By age 7, they tend to see the white person experiencing more pain than the black person. By age 10, it is pronounced. And studies have done not just looking at what people report in terms of the pain they experience, but they've done studies where they have hooked people up and are looking at their brain, what's happening within their brain, and looking at those parts of the brain that reflect compassion and empathy, and that empathy gap it persists. So one of the challenges we face is, how do we tell the story? Because it's narrative that changes, that and connection that makes a difference for empathy. How do we tell the story of the challenges of disadvantaged populations in a way that emotionally connects with the public, so that the American public and around the world, because this is a global phenomenon, arises to say, this is unacceptable in our country, we can do better, we have to do better. Let me just make another point that's really important. We have made much less progress in the United States than most people think. Most Americans think we've made a whole lot of progress. Martin Luther King and the Civil Rights Movement, and the problems have been solved. Let me give you one statistic that illustrates the challenge. If I look at national data from the U.S. Census Bureau on median household income, the average income of American households, in 2018, African American households earned 59 cents for every dollar of income white households earned. So that's a big gap. Importantly, that gap in 2018 is identical to the black-white gap in income in 1978. And why did I pick 1978? It was a peak year of the narrowing of the black-white gap in income as a result of the civil rights policies of the 60s and 70s and the anti-poverty, the war on poverty of the 60s and 70s. The gap was worse, and then it got to 59 cents. And in 2018, it is still 59 cents. Has it been stuck at 59 cents throughout since 1978 to 2018? No, it got worse throughout the decade of the 1980s, and it was not until the mid-1990s it got back to 59 cents, and it's a penny up and down since then. The point is, we have made a lot less progress than most Americans think. There's a lot of work to do, and as Christians, we should be at the forefront of of making the investments, of raising the awareness levels of these challenges, and of working to address them.